want to say that I don't want to keep it too formal, like a lecture. So I would encourage the participants to, interact. So before I actually go into what I would want to say about human metapneumovirus, I would want to know what people think here is human metapneumovirus. You can start typing in your chat box, so which should be able to see, because it's important to understand your uh, perception of it before I go on talking about it. So I'll give around 30 seconds. This is me. I've already been introduced, so I'll just skip this slide. I have a very small disclaimer. You may see a lot of cats in the background moving around in case. So sorry for that. And then we'll go on to human metapneumovirus. So what do you actually guys think is human metapneumovirus? Why is it a buzz now going on at this point of time? Yeah, understands the normal cold and cough, not to worry much. Yeah, I think that's a very genuine and correct to a lot larger extent. So let's start. So what do we are going to learn in this or here in this webinar is what causes it, what are the prevention measures, what symptoms, and how do you think actually hMPV should be managed, and also to give you some knowledge so that you are empowered to protect your family and not get misguided by a lot of these media frenzy and social media which is going on all around. So let's start with, I hope you're able to see my slides. Yeah. So human metapneumovirus. Okay, cool. So human metapneumovirus is not a new virus. It was discovered in 2001 in Netherlands during winter season where they actually did a PCR and they found that some virus was slightly different. It is a single-stranded RNA virus, slightly different from other uh, flu viruses, and that's when they kind of named it as human metapneumovirus. Why it is named so? Because it can affect human, it can also affect birds, and it can also affect other insects. Meta is more in the sense that it kind of meets the human body and causes an infection in the lung. Okay, it can cause, it doesn't have to cause all the time. Now, it causes respiratory infection similar to RSV. So, RSV is a common terminology for respiratory syncytial viruses. So if you have small children less than 5 years, or if you have premature children, you might have heard this from your pediatrician talk about something known as RSV. Now, it can affect individuals of all ages, but young infants, that is, young infants, when I say, is less than 1 year, young children less than 5 years, and more than 65 years of age, and immunocompromised patients. Now, immunocompromised means something you've been on some chemotherapy, you have cancer, or you have some other disease for which you have been on long-term medications. Now, these are the ones who are at higher risk. Now, how does it spread? Now, this is, I think, the most important thing which needs to be understood, and you don't need to panic. Now, I think with COVID, there was a lot of panic because now COVID was an airborne spreading. Now, airborne spreading means if I emit a virus or emit a bacteria or emit a substance, it stays in the air for some time and it can affect another person, even though I am not in close contact with that person. Whereas hMPV spreads through droplet infection. That means somebody has to be coughing near me, somebody has to be sneezing near me, or I have to be in a very close contact. For example, like a mother feeding a child, or when you're caressing your child, or when two children are sitting next to each other in the school. So that is a very close contact, and they have to cough or sneeze. That is when it is going to spread. So it is not airborne, it is a droplet. Also, it can spread via contaminated surfaces and close contact. Contaminated surfaces, if I'm coughing and I'm, my sputum is falling on the table or something, and if that is not getting cleaned, then it can spread. Or if I am coughing on my hand and then using the same hand to touch a door handle, yeah, that can also be contaminated and can spread. And when do we see? We do see it in winter and early spring, and most commonly in temperate climates. So if you are somewhere in the north of India, like Delhi, or if you are somewhere much colder than what it is in Bangalore right now, yes, the chances of you getting hMPV is much higher. Or if you're abroad somewhere in UK or Toronto, where again the winters are viruses are more prevalent at this point of time, you will get these viruses. So I think that is very important to understand that it is a droplet spread and not airborne spread. So you don't need to panic as much as the panic was there with COVID. Okay. Now, what are the symptoms? Now, these symptoms can be very mild symptoms, which is again, as somebody pointed out, like a runny nose, cough, fever, nasal congestion. Now, it can become severe, wherein it includes difficulty in breathing. That means your child is breathing faster. There is a wheeze. Wheeze is either, something like somebody is coughing and you're producing a sound like somebody is not playing the flute properly. So when somebody is not playing the flute properly, you get a very bad kind of sound. That's your wheezing. And fatigue. So if your child is fatigued in between the fever, so during the fever, most of them will not be active. It is fine. I'm sure even adults are not active when you have having fever. But in between the fever, the kids should be active. So if in between the fever they are not active, that is a severe symptom. Complications is bronchiolitis, pneumonia, and ear infection. So what's bronchiolitis? Is basically you have your airway. Now, airway is what takes the air from the back of your mouth to the lungs. So, and those can get affected. That is the most common uh, complication which we see, especially in infants. Pneumonia, when the lungs are infected, not the airway, but the lungs are infected, and ear infection. So, bronchiolitis and ear infection are something which we see more commonly in infants. Pneumonia is what we see more commonly in 1 to 5 years, and then immunocompromised children. Okay, so again, it's not a very specific symptom, so you may not be able to pinpoint, or your doctor may be not be able to pinpoint that yes, this is hMPV only. Now, how do we diagnose? So again, clinical evaluation based on these symptoms, laboratory tests. Now, when do I recommend that you do a PCR? If your child is just having a common cold and it's 48 hours or 72 hours, and then you're not traveling anywhere, or the child is not going to school, or there is nobody else who is younger or elderly whom you think there is a chance of infection, then you don't need to do it. But yes, if the child has to go to school, there is some exam or there's some activity, and you want to make sure that it is not spreading to the other kids, it is better you do a PCR to know what exactly is the causative organism. If you're traveling somewhere, again, you do not want to spread it to everybody in the flight. Yeah. So again, you do a PCR then. Or if you have somebody who is, lesser than 1 year of age at home, or an elderly person who is, more than 65 and is on medications, has some chronic illness, then you do, so that you can prevent the spread of it. And what is the advantage of doing it is also that if we know that this is the virus causing it early, then you can avoid taking unnecessary antibiotics, unnecessary cough syrups, unnecessary medications, and have a close vigilance. You know that, okay, these are the things which can get wrong. So you have a close vigilance, and then you go back to your doctor earlier and prevent complications. Okay. Now, what is the treatment and management? Now, the treatment, there is no specific antiviral treatment available. So, unlike influenza, that influenza A or B, where we have Fluivir or anti-flu or oseltamivir, we do not have any specific medication here. So, there are very few viruses where we have specific antivirals, which includes herpes, influenza, COVID to some extent, and human papillomaviruses. The rest all viruses are kind of self-limiting, and you do not need antiviral medications for them. Now, supportive medication, the most important thing, and this is the most important thing, is hydration. We have a lot of parents who always come to us and saying the child is having cough and cold and fever and he's not eating. So my first question would be, as an adult, are you also going to have full meal? No, you're also not going to have a full meal when you're having fever. So we should not expect the same from our children. So what is more important is that they are drinking water or some juice which is homemade or some kind of soup at a regular interval, because coughing, sneezing, and fever causes insensible loss of water from the body, and water is the most main component of the body. So you keep them well hydrated, give them rest, make sure the fever doesn't go too high. Now, a common question again asked here is, do I give cough syrup or not? Now, most of these symptoms are nasal. So we need to make sure that your nose is well humidified. So using saline drops, using drops to prevent nasal congestion is very important, which we actually always see a little bit lacking because it is difficult to give and the children may not take it. What is easier to give is some sweet cherry cough syrup. But then the problem with that is you are going to suppress the cough, and cough is a normal mechanism through which the body is trying to expel the sputum. So if the child is coughing for very short durations in between, do not give a lot of cough syrup. But if the cough is affecting, either the child playing while that starts coughing, or the cough is affecting his eating, like he's drinking or eating and then again, has bouts of cough, or if he is not able to sleep, then you give adequate cough syrup to suppress the cough. Otherwise, they need to sneeze and cough because that's the only mechanism through which the phlegm is going to get out of the body. Yeah. Now, rest, yes, it's very difficult. If the kids are playing, then it's fine. There is no harm. But if they want to rest, let them rest. But you should be able to identify between them not wanting to do versus not able to do. So if the child is having fever and our fever has recovered and then he doesn't want to, he wants to kind of rest, that is fine. But not able to, in the sense he tries to, but then there is some weakness, then that is something alarming, and then you need to approach your doctor. Okay. Now, most of them do not require any hospitalization. Maybe it may require you to, visit the hospital OPD services maybe more frequently as follow-up, but most of them do not require hospitalization. The most important reason for hospitalization would be when your oxygen levels are low. So this also can be kind of easily checked at home. Now, oximeter is available very easily. So if your child is having, fast breathing or like that, you can always check the oxygen levels. If it is more than 94 while they are active, then that is enough. If it is less than 94, then you need to go to the hospital. While they are sleeping, if it is more than 90, it is enough. Okay. If it is less than that, then you need to probably go to the hospital. Now, I'll come back to when you need to go to your doctor and when you need to visit the emergency room separately. Now, consider your child has a common cold. Now, how do you prevent the spread of it? So this is just an outline. Wash hands frequently, disinfect commonly touched surfaces, avoid close contact, and encourage a healthy lifestyle to boost immunity. I'll go a little more detail to each one of this. Now, first is practicing proper hand hygiene. Now, teach the children to wash their hands frequently with soap and water for at least 20 seconds. I think that's, there's a tap water and they just do like this. So at least 20 seconds. So you ask them to count for uh, 1 to 20 with a gap. Then use alcohol-based sanitizer if soap and water is not available. Now, we do not know sometimes the quality of water, so you can always just use an alcohol-based sanitizer. Avoid close contact with sick individuals. So keep the children away from individuals who are coughing, sneezing, and avoid crowded places, especially during when there is a lot of flow going on. Avoid crowded places. Okay. Now, why this is saying? Now, I already said that it is not airborne. Now, because there is hardly any practice by any person who is affected by cold and cough to wear masks in India. Actually, here, what we will do, we will ask everybody else to wear mask, but the person who is sick is not wearing mask. So, what is important? That is the reason why you need to avoid crowded places. Okay. Then disinfect commonly touched surfaces. So regularly you clean their toys, the doorknobs, electronic devices like phone and your iPads and iPhones with disinfectant. So make sure those are clean. Are my slides moving or?
Yeah, moving.
Yeah, okay. So boost your child's immunity. Again, you don't need a pill to boost the immunity. So regular balanced diet of rich in vitamins and minerals. So I usually say 5 on your plate. So you have good cereals, you have good dairy, you have a little bit of fat, a little bit of protein, and make sure they are eating whole grains. Okay, and ensure the child gets adequate sleep and stays hydrated. Now, hydration is again very important. Then keep sick children at home. Unless and until it is very necessary, you can make sure that uh, unless and until it's very necessary that your child has to go to school for some exam or something like that, then, sorry, that was my cat. Keep the sick children at home. Okay. So those are the main preventive strategies which you can use at home. And that doesn't apply only for hMPV, for any influenza, flu-like symptoms. It is important. Now, when to seek medical help? So medical help is just going to your doctor. You can just go probably in the OPD. Okay. Now, one has difficulty in breathing, or you actually hear wheezing or a wheeze-like cough. Now, develops a high fever that doesn't subside with medication. So your fever is 100, 101, and it is not coming down with just paracetamol, or some of you are also using ibugesic or mefenamic acid according to your pediatrician's prescription, then yes, show signs of dehydration. Now, that is the dry mouth, there is reduced urination. That's a very important thing. Your child should pass urine at least once in 4 to 6 hours. Okay. Excessively drowsy, irritable, or unresponsiveness. That means he's drowsy or irritable in between the fever episodes. Okay. And you have given whatever adequate home care, and still you feel that the symptoms are not improving, then you can go for OPD. Okay. Now, there are certain children who are kind of at a little higher risk. Now, those who have diagnosed asthma or who are on regular inhalers, those who have weakened immune system, that means they have some immunodeficiency disorders, or they have some, sorry for that. Now, when should I go to the emergency? Okay, that was to a regular OPD. Now, on an emergency, where do I think it is emergent and I definitely have to go? Is one, when your temperature is more than 103, is reached 103, then yes, because then there's a lot of dehydration which can happen and you need to bring down the temperature quickly. Now, difficulty in breathing, you're seeing that there is some indrawing above and below, bluish skin, lips or nails, or worsening of other health conditions. That is mainly for adults as well. That there are other conditions like, the BP is going up or the sugars are not getting under control, those kind of things. You go to the emergency immediately. Now, this is not needed. Now, there are few questions which, can commonly be asked. So, can adults? Yes, adults can catch hMPV, especially if you're working in your spaces in your IT hubs. It is very common that you are going to catch, but most likely it will be just like a common cold. It's not going to cause a major in your adulthood. Now, it is the same as RSV? No, it is not the same as RSV because they are different viruses, but the symptoms are quite similar. Okay, and it is important to recognize because RSV is actually a much more invasive or much more serious uh, viral infection. How long does it last? Now, actually, I recently saw a meme which kind of told this in a very nice way. It's a human metapneumovirus. That means it infects humans, it meets them, it causes pneumonia, and it goes. So it doesn't stay for a very long time. So normally it is 3 to 6 days, but it can last up to 2 weeks, depending on where you are and how your other conditions are. Is there specific treatment? No, there is again no specific treatment. What medications your doctor may give is one, is basically fever controlling measures. Two, to prevent nasal congestion and to make sure that you are able to remove the phlegm. Third, if they are getting pneumonia, if they are getting hospitalized, then antibiotics may be necessary to prevent secondary infections. Okay, because your immune system is kindly going to get suppressed. Okay, and some of them, if they're having wheezing, if they have lots of pneumonia, they may be also given steroids. Okay, it's important to understand that steroids, as a lot of people have an assumption and presumption that it's a very bad thing for kids. But per se, steroids, when given in the right dosage and at the right time, it's actually a lifesaver. Now, can children be reinfected? Yes. Most of your kids who are now 5 years and above would have had definitely one episode of hMPV by now. It's just that they never got tested, which is fine. So they can get reinfected because there are different strains of hMPV. Okay. However, because the immunity which you develop is very short lasting. So you are not going to have the immunity against the virus for a very long time. Okay. Now, unlike other infections or unlike dengue or unlike flu, where the repeated infections are much more severe than the previous infection, in hMPV, the subsequent infections are usually milder than the previous one. Okay, so that is something which you need to keep in mind. Now, are certain children more at risk of severe? There are these kids whom I would want you to take to your pediatrician earlier, the better. One, those who are under 6 months because they are just under breast milk, okay, or formula milk. So their main immunity is through the milk. So the immunity is much lesser. Premature babies. So if your kid was born at 28, 32, 34 weeks, then yes. Children with chronic respiratory or cardiac conditions. If your child is on regular inhalers for asthma, or your child has had a cardiac lesion, has a cardiac surgery before, and those with compromised immune system. That means your child either has some blood disorders, thalassemia, has some cancer, or is on long-term medications, or has some kidney issues. Those are the children who are at higher risk, and those kids you need to take to your pediatrician much earlier. Now, so I think with that, I'll come to the end of the presentation. I'm not gone into too much of scientific things because I feel what is important is to just understand these important things. That one, it is not a new virus. It's been there for last 20, 23 years in or more than that, but we have discovered it around 23 years ago. Second, it is spread through a droplet and it is not airborne. So it is more important that you avoid close contacts. Yeah. Second, it is important to be aware that it is something very similar to common cold, but yes, can get complicated in certain individuals. Okay. So it is important that you know this so that you are not in a panic and there is no panic around you. The simple preventive measures are basically that you have good hygiene and you consult a doctor when needed, and most importantly, it is important that you have this knowledge, but you ask the right questions when it is needed. So if you want to summarize that if you're older than 5, you probably already had it at least once. Okay, and most of the time you will get better at home in a few days. But sometimes it can cause serious complications. Okay, so young children, adults over 65, and people with immune weakened system, okay, are at higher risk. So talk to your pediatricians for any concerns you have. Seek medical care right away when you feel those conditions are met, and if there is trouble breathing or any other signs of serious illness. Okay, so with that, I conclude my presentation. So having this knowledge is basically about having the right answer, but how you're going to get right answer from your doctor depends on if you're asking the right questions. Thank you.
Thank you, doctor. That was a wonderful session, and your slides were also precisely what we all wanted to know. Thank you very much. We will open the forum for any question and answers now. So I don't see any questions posted in the chat. Though I had some questions which were given to me before the start. If anybody has questions, they can just put a raise hand in the Zoom and ask doctor.
So I think it's yeah.
We are not able to hear you.
No, I am able to hear doctor.
Okay. If we have any questions, sir, otherwise.
Yeah, how to differentiate between common cold and this? You said it is
So
48 hours to 72 hours we'll have to wait if
yeah,
no seniors or little kids are at home.
yeah.
But
So I
will it
don't.
not be, sorry, yeah, doctor.
Yeah. So I don't think you'll be able to differentiate between hMPV and common cold because it is one of the causes of common cold. So when we say 48 to 72 hours is normally your common cold will also take around 3 to 5 days, sometimes even 5 to 7 days for a common cold to go away. So if they are just having the mild symptoms, then waiting up to 72 hours is okay. After that, if they're still having fever, then you consult your doctors. And then if you want, you get tested. But yes, as you said, if you have already senior citizens, somebody who is higher risk, like somebody who has diabetes, hypertension, or some kidney disease, where you don't want it to spread to them, and kind of you cannot prevent the kid going to them or going into close contact with them, then it is better that you get tested earlier. Okay, so yes, it is not possible to just clinically differentiate that it is common cold or it is hMPV because it is the cause of common cold per se.
Thank you, doctor.
Okay, we have another question from Chitra. Ma'am, you want
This
to
actually,
ask? You want to ask, or you want me to read it out?
Hello. Yeah, hello, doctor. So I just want to check whether no, it's always associated with the fever
uh,
or only the normal cold and cough.
yeah. So it is not always associated with fever. It does not have to always be associated with fever. But in younger kids, like if they are less than 5 years, then the chances of them getting fever is higher because fever is basically a response of the body to fight the virus. So if they're older than 5 years, then mostly they would have come in contact with it before also. So they may not have fever. They may just have runny nose. They may have nasal congestion or a little bit of cough. Yeah. So yeah. So the answer to that question is no. They don't have to be always associated with fever. But in younger children, the chances of fever is higher. And again, the same thing holds good for somebody who is more than 65, 70. Them again, there is always chances of fever is higher because the immune system is slightly weak and it is fighting against the virus.
Thank you, Doctor. I'll actually ask one question before the webinar. Somebody asked me, with especially COVID episode, we all unfortunate times which we had during COVID time. I think people are very much aware of viruses and its implication. Now, in the news, there has been a lot of talks about this hMPV and again an outbreak in China. And kind of initially the reaction of our citizens were like they were scared again. But then from the medical fraternity, we came to know that it has been there in India for quite some time, and perhaps we already had it in the past. We don't know. Sir, my question would be that like COVID, which went through many mutations, and every mutation being either more deadly or more subtle, does the same thing happen with this hMPV virus? Do we expect that it will again mutate and manifest as a more deadly form, or is it like because it has been here, we don't really have to worry about it?
Yeah, okay. So two answers to it. So most of the viruses are more clever than us. So the moment they know, okay, human beings are understanding how I am working, they'll change the way they are going to work. Now, being a single-stranded RNA, this is a little more technical, but it's important to understand. It's a single-stranded RNA virus. So the ability of it to mutate is lesser compared to COVID. It can, and it has changed over a period of time, but the ability is less, and the severity at which, or the once it changes, how severe the infection can be is also less. Okay, that is having said the first thing. Now, second important thing is, which I already mentioned, is how it is actually spreading. Now, in COVID, yes, there was mutation, but most important thing was how it was spreading. So it was an airborne, like it could stay in the air for some time, and it could affect somebody who is a little more farther away also. Okay. Now that doesn't happen here. So how much ever it is mutating, so it is going to mutate in somebody who is infected. So unless you're coming in close contact with them, you're not going to get affected. Okay. So yes, mutation is definitely possible, but the chances are lesser. It is less severe. And because it is droplet, the chances of transmission is lesser. I hope that kind of gives you an idea.
Sure. Thank you, sir. Another related question to that was, and every time, pardon me, I'll relate it to COVID only. After COVID, and you can correct as a doctor, there has been talks about secondary implications of people who have been infected. I'm not sure how much it is true, but younger people getting heart ailments are also getting tagged to because they had COVID once. With this virus, also, do you see any secondary implication, or it is just like any other common cold virus?
Okay. So the first part is correct. Yes. So we are seeing a lot of post-viral immune modulation is what we call. That means your body's immunity is kind of changed, especially those who have been infected with COVID. Okay. So there are some things which are more common, like the formation of clot has become more common. So that's why people are getting heart diseases. The chances of sugar intolerance is again more. So there are more people who are getting diabetes after they've got COVID if they didn't have before. So that is all fact. It is not untrue. Now, coming to human metapneumovirus, we have not seen a lot of immune modulation post hMPV in the last 22 years. Okay, so it can happen. Somebody who has got a severe infection, for example, somebody who's got a pneumonia then their propensity of that person getting again and again lung infection will increase. Okay. But on somebody who has just got a simple common cold is not going to have any immunomodulation or is not going to have any change in their long-term immunity. So if they have a serious infection, then yes, but if they have just developed common cold because of hMPV, then no, there is not much risk of having post infection changes in the body. I think
Thank you, sir.
somebody has raised
Yeah.
hand.
Yeah, Subhash, you can go next. Subhash, you can unmute and ask the
Yeah.
question.
Thanks, Upendra and Dr. See, fundamentally, like since we are from an apartment complex, at what is there any measure which we should do? Because as far as awareness is concerned, a lot of people are able to read and get the information. But is there something which, at an apartment level, the association or anybody needs to do anything other than the awareness?
Yeah, I think what something which can be done or which should be ideally done in any apartment or for any of these conditions is making sure that the person who is sick is not roaming around in the apartment. I think that is something which is quite difficult to control, but it is important to control because see, you cannot restrict everybody else because one person is ill. So rather than the restrictions, you can bring about like, okay, these are the features. If you're having these features, one is, you stay at your home, don't go around. And if you are going around, you wear a mask. I think that is something which all apartments should do, not only in case of this hMPV, even in case of other flu. See, because we are also seeing a lot of this flu, how it is coming, it is going to come from somebody who is infected only. How they are going to get exposed to that person? Because probably an adult who is coming back from office, he has some common cold, but he is not bothered whether he's coming across some child in the corridor. So they are not wearing mask. So I think that is a simple thing which apartments should. I won't say impose, but you should put it saying that anybody who's having cough cold and you're actively coughing and sneezing, you wear a mask. And second, if you are sick, you stay at home and not just see, because a lot of them will stay at home, but then they're roaming around in the apartment, right? So that is not correct. Because if you're at home means you remain in the four walls of your house and don't roam around in the apartment giving it to others in the apartment. You don't want to give it to others in the office. So in the same way, don't give it to others in the uh, apartment. Now, there is no vaccine yet for hMPV. So if there was a vaccine, I would have said, yes, you should vaccinate everybody and at least those kids who are below 6 years. So that same thing holds good for influenza. So there is an yearly vaccine for influenza which is given. So apartment can also, kind of make it or make the people aware and at least direct them to nearby hospitals and say that they get yearly vaccines. It's not that it is going to prevent it completely. It is going to reduce the seriousness of the infection or severity of the infection, because nothing is 100% in medicine.
Doctor, the challenge is that at apartment complexes, we would come to know if somebody reports it. Somebody, right? So if it is not reported, there is nothing that we can actively do. And since there are a lot of group activities in an apartment complex, people play different kinds of games as groups. There are various cultural events which take place where there's a congregation of people, adults and children mix together as or play together or come together as groups in various activities. So unless it is reported, and if it is not reported, what can we do other than spreading awareness? But is there one thing which can be emphasized upon repeatedly, and up to what? Let's say we are now in the month of January. How long do you expect this to become a cause of concern? Jan, Feb, March, or till summer starts?
Yeah.
What would be the indication?
Yeah. So it would last till like Feb. I think March it won't, because already we are seeing that the afternoons are quite hot. So I don't think by March it will be there. That is one. So I think one thing which you can do at your personal level is basically, maintaining your hand hygiene and making sure you're not touching here and there without using a hand scrubbed or a hand rub before, and use a hand rub after. I think that is what you can do at a personal level. Secondly, what I think you can also do at an apartment level is also look into why people don't want to report. Is probably the imposed conditions or something like that. Is they don't want to report because, yeah, so maybe that can be looked into why they don't want to report, and kind of increase the reporting, so that they also are getting some kind of support from the, yeah. Otherwise, so again, I wouldn't recommend everybody wearing mask for a hMPV, because even if you are wearing a mask and somebody is coughing on you, you are going to get it. Yeah. So uh, it's only going to, a mask is going to prevent something which is airborne, which is always in the air. This is happening only when you're in close contact. If you're in a close contact and wearing a normal mask, it is not going to do anything. Rather than that, the person who is actually having should wear mask, so that the droplets are not falling into the air or into the surrounding. But the simple thing which, sorry.
Doctor, can I just add one more thing? See, one of the most common places where there is this close contact in an apartment complex is the lift. Okay, so in the lift you come together and you're very close to each other. 7 or 8 or 16 is the capacity. People stay in the lift for maybe 1 minute, 2 minutes, 3 minutes, and if somebody is coughing, that's the single biggest danger.
Yeah. So so again, there you can't do anything if somebody who is having and is coughing. So at least, even if they are not wearing a mask, at least they should, use their hand and to cover their mouth and nose. And the problem with that, what we have seen is, they will cover their hand and mouth and nose when they're coughing. After that, they're going to touch the lift with that bare hand. They are not sanitizing. So उसमें क्या हुआ कि instead of giving it directly, you are giving it putting it on the lift buttons. So next somebody comes and touches that button, and then he will touch his mouth, especially kids, because kids are very fascinated with those buttons, They will touch all the buttons and then they will put the hand in their nose. So then you are kind of spreading the infection. So I think the awareness, but the responsibility should come on the person who is actually having cough and cold, and not on somebody who does not have. So I think that is something which needs to be reflected in these.
So a cautionary note display within the lift would be the most effective.
Yeah, that if you are having a cough and cold, kindly wear a mask, and before touching any places in public areas, kindly use a hand rub. I think that would help, or sanitize your hands before you touch these areas. I think that would kind of help. And that will also help you when not only in hMPV, all the other flus, all the other influenza, everything is spreading like this only. So, means I may be a little blunt in saying, usually most of these precautions are taken by families, but there are these people who are bachelors, and people who are not having kids are the ones who kind of neglect these, but they don't realize that that is implicating into some kid having some very serious infection somewhere. I think once they kind of start reflecting on it, they will probably start using these precautions more uh, evidently.
Great. Thank you, Doctor. Thanks, Supendra. That's from my side. Thank you. Very, very interesting.
Very good questions, Subhash. Thank you very much. We still have some time. If anybody wants to ask questions, they are welcome.
I would want to ask a general opinion of, because I don't stay in an apartment. So what is the general response, or what is the general rules you have in apartments when it comes to, these kind of illnesses? Is there something which actually goes into practice and somebody monitoring it, or?
Upendra, can I respond to that?
Yeah, please.
Yeah, I think, see, one of the basic behavioral tendencies in apartments is that until and unless some crisis comes up, it becomes difficult to enforce, or quite a few things that we would like to do out of abundant caution. So awareness and very, very pinpointed communication is what helps in apartments, because we have such a diverse kind of people populating the apartments. It's not, and we cannot like move into penalties, because as an association, as associations, penalty is the last resort. But when there is a crisis, people tend to listen. When there is no crisis, people tend to ignore or be casual. That's a challenge which apartments everywhere face.
Yeah, chalta hai syndrome. Yeah, I agree. I think that's there everywhere. And I would just like, because there is time, I would just like to emphasize this point, which I also said during my presentation. There is a very clear tendency of working parents, especially if both the parents are working, to use a lot of cough syrups. I think some of my patients, when they come to my OPD, get offended when I say don't give any cough syrup and don't give anything to stop the sneezing. But then they'll say he has to go to school. They'll not allow them to cough, because nowadays schools have, some horrendous rules, which makes, kids just so difficult to express themselves. But I think it is very important to understand that using, cough syrups or decongestants or cold syrups is warranted only if that is actually causing some problem or issue in a day-to-day working of it. Like if your child is coughing and he is playing around in the house, then don't suppress that cough, because that cough is actually what is going to remove the phlegm, because otherwise kids cannot remove phlegm and spit it out like adults. So they will cough, it will come to the back of the throat, and then they will swallow it. Yeah. Now, once it start affecting, like, they are not able to play, they're not able to eat, or they're not able to sleep, only then you kind of use these cough syrups or the cold syrups which are there. Because what we see is a lot of time the cough subsides and then they come back to us with, difficulty in breathing or fast breathing or wheezing, because, the phlegm is still there in the body. So I think that's just one thing which I would want to share to everyone.
Thank you, Doctor. Last call, if anybody has questions, otherwise you will conclude it. Going once, 2, 3, so yeah, no questions. Thank you very much, Dr. Manju, for taking your time out on Sunday to make us aware and give such a useful information on this issue. And thank you very much, all the participants also. We were expecting 30 plus participation. We had got registrations that way, but looks like Sunday could be a factor which we couldn't. But this session has been recorded and it will be put to BAF YouTube channel. Doctor, we will share the link with you once this is done. We have a collaboration, again, I am mentioning, with Rainbow Children Hospital, and our objective is to make aware our citizen on how to live well, how to deal with diseases, and who could be the better people to brief us other than the doctors themselves. Dr. Manju Nath, again, thank you very much. Everybody, Dr. Manju is with Rainbow Children Hospital. If you need any consultation from him, of course, he will be available. So I'm doing a little awareness for you also, sir. But thank you very much.
Thank you.
And thank you very much, everybody, for joining.